The Bustamante Hospital for Children is one of the 9 hospitals in the Southeast Regional Health Authority. We are a team. We work together to make it happen. As part of SERHA, we look forward to the changes that are coming. Our recent achievements include infrastructure development. We have the establishment and the construction of the NHF Bustamante Hospital for Children pharmacy. This pharmacy is a drugstore pharmacy, and it provides a service for both inpatients, outpatients, and for the wider community based on the need. It gave us the capacity to increase the spaces that we required for delivery of service and to improve the customer service for our patients. We're indeed proud of this brand new building, which was opened and has now been able to serve in a better and wider environment for our staff and our patients. We not only have completed the construction of the NHF pharmacy, but in collaboration with the European Union, the Jamaican government, we were one of the partners and were successful in completion of the PROMAC Neonatal High Dependency Unit. The PROMAC program for the reduction of maternal and child mortality. And it is by this means that we now have a 10-bed high dependency unit, 2 isolation areas and 2 isolation rooms and 8 vehicles. It is with this opening of this unit that we look forward to improving the lives of our neonates, the small babies who require critical and intensive care. We're indeed proud of this achievement and the collaborative effort that made this possible. One of our major challenges is that we have outgrown our capacity. When we moved here in 1963, the capacity of the hospital was 200 beds, moving from the capacity of 40 beds at the Kingston Public Hospital. With the addition of the cardiac unit, the 10-bed ICU, which was opened in 2018, and the PROMAC HD unit, which was opened in 2020, we have now expanded the capacity to 279 beds. But even with that, we need more space. We need more ward capacity, especially for the specialist services. It is indeed our vision to improve the capacity of our wards so we can accommodate patients who need to be admitted for specialist care. With that said, the Ministry of Health, in collaboration with National House, with NHF and National Housing Trust, are in progress of building a 2-story building which will house on the ground floor a parents' overnight suite with a capacity of 20 spaces, as well as a 20-bed cardiac ward on the 2nd floor. This is just the beginning of our dream to increase the capacity of the inpatient capacity for the Bustamante Hospital for Children, with capability to now go multi-story dimension in terms of construction. It is our hope that with collaboration from private sector, public sector, that we will be able to go up to the 5 floors and improve the capacity of our inpatient wards. We are also envisioning that with the 10-year strategic plan of the Ministry of Health, that the Bustamante Hospital for Children will benefit with improvements to the accident and emergency department, to the ambulatory outpatient department, to providing improved diagnostic services with the establishment of a CT scan. At present here at the Bustamante Hospital for Children, we already have ultrasound and fluoroscopy available. But again, as technology advances, we have to keep up with technology, and we need to upgrade our equipment and ensure that we are keeping up with the technology that can provide the best quality care for our patients. With the improvement in ICT, we look forward to the use of technology to make our work and our services for our patients and their families better. As such, we seek to develop the accident and emergency department of the Bustamante Hospital for Children. In fact, all accident and emergency departments across the Southeast Regional Health Authority. It is important that we support this development. It is our aim to be able to triage early, identify cases early, as well as to expedite and introduce our management quickly, as well as to manage these patients that they can be easily sent to the areas that are required. This is where the world has already gone, and there's where we want to go. to improve the ambulatory services in terms of our capacity as well as our service delivery. In this way, our aim is to reduce the number of admissions by addressing matters early in the outpatient setting. Our outpatients department also needs expansion, and with improvement and introduction of ICT services, we envision that we will be a first-class, world-class, world-leading pediatric hospital providing care for our outpatients and our inpatients. So over the many years, we have had successful collaboration with our local and overseas sponsors. This collaboration has yielded fruit. One of the major collaborations has been in development of the cardiac services here at Bustamante Hospital for Children. As the only pediatric cardiac unit in the island, it is important that we recognize the establishment of the 10-bed cardiac ICU, cardiac catheterization unit, and the cardiac operating theater. Without this, we would not be able to continue to progress the services and development of cardiac services here in Jamaica.